And medical experts want government to formulate policies that will create awareness to drive the reduction of hepatitis in the country. They say more knowledge about the disease will ensure its treatment is effectively tackled, reduce the burden on government, and attract support from international donors. Helen Osamede Akins reports.
Hepatitis is an inflammation of the liver that causes a range of health problems, including liver cancer. There are 5 main strands of the hepatitis virus: A, B, C, D, and E. Hepatitis B and C are the most common causes of deaths. Nigeria, with an estimated population of 200 million people, has a hepatitis B prevalence of 8.1% and hepatitis C prevalence put at 1.1%. This is based on a recent report by the Nigerian HIV/AIDS Indicator and Impact Survey. Despite the high rate of infection, majority of Nigerians have little knowledge of the disease or whether they are infected. This portends some dangers for the populace, as those infected can either infect others or go on to develop liver disease.
I don't know anything about hepatitis. I heard about it, but I don't know anything about it.
When you bother yourself too much about too many things, it may lead to hepatitis.
Do you know your hepatitis status?
I don't know, because I've never encountered it before and I don't wish to encounter it.
To bridge the gap, experts want government to review its policies to create room for awareness.
So the policy environment is very important. Even for donors to invest in your country, there has to be an enabling environment created by policy, and that policy can also contribute to reducing the burden, because it also creates an environment for treatment. It can reduce the cost of treatment, which for now is not supported, and so it's still a bit, unacceptably very high.
But for several years, it was like a neglected disease, or a neglected infection. It was only in 2014 that the world recognized that we need to do much more than we are doing now. That's just 6 years away.
Hepatitis B can be prevented by vaccines that are safe, available, and effective. The theme for this year's Hepatitis Day is Hepatitis-Free Future, with a strong focus on preventing hepatitis B among mothers and newborns. Helen Osamede Akins, TVC News, Abuja.